All right, time for Health Connections, our weekly feature. And tonight we welcome in Dr. Jonathan Wilson of the Grand Island Foot Clinic. He's in our Grand Island newsroom. And Dr. Wilson, thanks for joining us tonight. Things must be going well. You recently opened an office in Hastings. Why the decision to expand there? What do you think?
Well, thanks for having me on tonight. The decision to open an office in Hastings, it was easy for us. We see a lot of patients that come from that area of town, from Hastings and sometimes further. And with them coming all the way to Grand Island, we thought it would be a good option to come closer to them and provide the services we have with less, expense on their part, whether it's time or travel. So bringing our services to them was one of the main reasons. With myself and Dr. Blackburn, who's part of our office, we've also been trained in rear foot and ankle procedures, and so it provides us an opportunity to expand and reach more people that may need those procedures as well.
Doc, all the services you provide at your Grand Island Clinic will be done in Hastings as well?
Not quite all of them. Most of them will be there. Only certain specialized procedures like our shockwave treatments or our laser treatments. Some of those can only be done in Grand Island where we have the equipment for it, but pretty much we can evaluate and see and do any other in-office procedure at the Hastings office just like we would in the Grand Island office.
Doctor, let's talk about scheduling then. When are you in Hastings? When are you in Grand Island? You're going to be a busy guy.
Hopefully. We're in Hastings Thursday mornings for now. As things pick up and get a little bit busier, we hope to expand our time in Hastings. It's a great community and one we'd like to serve more. But for now, we're in Hastings on Thursday mornings. And any other day or time in Grand Island.
All right, Dr. Wilson, let's talk a little foot care here. After a long week at the State Fair exploring, what's the best remedy for tired, achy feet? What do you think?
That's a good question. It really depends on what is going on with the patient's or with the person's feet. Now, I hope most people that were out at the State Fair were smart and wore good supportive shoes to help protect their feet and get away from some of the injuries or things that could occur. From being on the feet, sometimes you just need to take a break, take it easy, some ice, elevation. But if it is something that persists, if anyone has any long-standing problems from being out at the State Fair, it might be worth an evaluation for further diagnostic testing or treatment that could help it heal a little bit quicker.
And you talk about that if you have long-standing issues, that's not something you really want to put off, right?
No. When something starts happening, most people think, hey, if I leave it alone, it might go away. Now, when we deal with the foot, we're really at a disadvantage. We're all on our feet every day, all day. And so having to get around and just do the daily activities can be taxing on our feet, even though we might not be exercising heavily or doing anything extra that we might think might cause things to flare up. Just being on our feet, if there's pain there, can continue to cause that pain and impede it from going away. So it's not something we want to mess around with, and the longer things hang around, sometimes the harder it is to get to go away.
Dr. Wilson, Grand Island Foot Clinic, thanks so much for being with us, and we wish you luck on your new venture there in Hastings.